Okay, so I'll talk a little bit about what we're trying to do. Somebody mentioned earlier, I think very usefully, in terms of the way that services work at the moment and how important it is to try to, sort of build bridges. And it's sometimes very hard to maintain the bridges because services are so different to how a lot of people would like to see them. And there are so many people who actually come out of them often feeling that they haven't been helped at all. And in fact, there's something on the news today. I've not actually had time to look at TV, but I was emailed about apparently something going on in the news today about mental health services and how so many people have been failed by them, and how actually, and it's very interesting, there's some statistics that just got sent around about how different levels of services have different levels of satisfaction, and actually there are less professionals that are in the service, so the more that they're charitable services, the more that they're non-statutory services, the better people actually are satisfied with them, the more satisfied with them. The more professionals we have, the less people feel listened to. So that's clearly the wrong way around. And so we need to do something to change that. The interesting thing is that many people now in the system also recognise that they need to do something to change it, because it's not really sustainable. It's been going on for about half a century, ever since kind of the medical model took its hold. So this is a conversation a little bit about what's been going on in the NHS about potentially changing things and more widely. So this is the way that we work at the moment, with a kind of professional in charge, with the professional being the one who diagnoses, who describes to people what's wrong with them, what it's called, as Lee was saying, giving them a label and then giving them a treatment. That's the kind of standard current model. Now, the CQC CQC survey, as you know, CQC are the regulators in this country for mental health care, and they have they regularly survey mental health trusts across the country. And one thing that they found is looking at 51 mental health trusts, and that's 15,000 service users they surveyed, and they found that statistics like this come up every time. Mental health services understand what is important to me in my life, 42% of people. So 60% of people feel that mental health services don't understand what's important to them, what is actually happening for them, what's really going on for them. They don't understand that, which is a pretty damning statistic. This is a lovely quote from a doctor, actually a GP, who himself had a mental health breakdown and then ended up in the system. And he says, the mental health care system and I were at cross purposes. What I was experiencing as a wonderful healing process was construed by my doctors as a serious disease process. Neither of us had a clue about the other's perspective. It is a process of giving birth to hope in the soul. It is opposed from within by equally intensive nihilism and fear that the entire creation is nothing more than a cesspool of doom. So the thing is that this guy was having his own deep experience, and there were positive aspects of it, there were negative aspects of it too. Unfortunately, the kind of traditional system labelled that as one big kind of disease, just an illness, and left it at that. Whereas actually it's a lot more sophisticated than that. And it's not all good and positive, but also it's not all bad too. There's real things, positive things happening through this process. Now, I always like to quote Charlie, and I hope he's in the room, because I don't know how I've done it with him in the room. That time he's not in the room today. I was really hoping to quote Charlie to Charlie. He just popped out. There's something going on, we can never quote each other on the same room. Anyway, so Charlie's study, as you may have heard today, he did a brilliant, fantastic study that I always quote everywhere. And what he did is he looked at people, I don't know if he's already mentioned this, but he looked at people who had non-ordinary experiences, who were in service and those who weren't. And the biggest difference, as you heard, was about validation. So it's about whether or not people around you actually are able to validate your experience without automatically saying, there's something wrong with this. This is seriously dodgy, you need to go and see a doctor. And that was the big difference. Now this relates to something else. Now what you may not have heard is this is a very well-known set of studies by the WHO, and interestingly we're all taught this in medical school, and then we're kind of led to forget it very quickly afterwards, because it's quite a profound outcome, and it's a very, very robust outcome actually, because there's a lot of strong data behind this. What they did is they looked at people with a so-called diagnosis of schizophrenia, and the first time they did this was in 1967, and they compared several thousand people with these diagnoses between developing countries and people in the developed world. And what they found is that there were lower relapse rates. The United States and other countries had lower relapse rates than those seen in developed countries. So people in developing countries actually had lower relapse rates than those in developed countries. Why is that happening? So they did it again, 30 years later in 1992. with a similar set, over 1,000 people. And again, they found that there's a more favourable in developing countries than in developed countries. So if you live in a developing country, you're more likely to get a better outcome than if you lived in the West and you had a mental health breakdown. It was repeated again in the year 2000, and they replicated the developed versus developing differential through long-term follow-up. They followed them up for over 13 years. And there was up to 5,000 people in these studies altogether. And they've repeatedly found again and again and again that if you live in a developing country, your initial episode may last longer, it may be more difficult, more problematic, but your longer-term prognosis, your longer-term wellness is likely to be better than it would have been in the West. Which is a pretty terrible thing if you think about it. But that is an indisputable fact. There's no, I've read a couple of journal pieces where people try to dispute it, but then very quickly a lot of academics will say, actually, you don't get data any more robust than this. Charlie, I just quoted you. Never mind. One day I'll tell you when you're in the room.
I was trying to sneak in because I just had a heads up that you had just said that.
Next time. So now, well, let's just go back to last time. So what this shows us clearly that there's something wrong with the way we're doing services at the moment. Now, there's something wrong has been known for some time. You know, I learned this back in 1990 when I was in medical school. So this has been known for a while, but it's kind of been swept under the carpet. But what's increasingly becoming clear is this differential between developing countries and developed countries is now bankrupting us in these countries. Because it's not possible to maintain services in this way anymore, where there are more and more people in services and people coming in. So there's a big indoor, but there's not much of an outdoor. Once you're in, you're in. Something like 80 to 90% of people who are referred to mental health services in this country have been in services before, even in the last year. So it's a bit like joining the CIA. Once you get in, you can never get out. And so this means that whereas you may have worried about it ethically and morally before, now financially it's something that's of great concern to people. In fact, chief executives and finance directors across the country, are now realising that the model that we've got is surely it doesn't work. It just couldn't possibly. It doesn't add up anymore. You can't square the circle. Which is why people are interested in looking at different models.